Okay, I'm going to be presenting a film critique on a L spine. Today's date is 7/14/20. The exam to be presented is a 3-view L spine. Image modality is X-ray. The date of the exam was 7/13/2020. The reason for the request was a motor vehicle accident, and she had a previous accident, I believe, a month before this. So 2 accidents. The projections are AP lateral and a spot. She is female, 23 years old. She was transported by wheelchair from ER. The physician's findings, there was no acute fracture or dislocation seen. There is slight levoconvex of the lumbar slight levoconvex lumbar scoliosis, which is seen here. It's curved to the left, so she might have slight scoliosis. Okay, so the image receptor used was a 16x16 digital image receptor. All the images were done at 40 inches SID in the table bucky with the built-in grid. And 40 inches, I said that. Okay, so first up we have the AP. This is, let's see, the technique was 90 kVp at 10 mass. The AP L spine shows clear trabecular markings. No motion is demonstrated. The contrast is high to demonstrate bony detail. The intestinal tract shows some air, but not enough to warrant a repeat. There's air here. So the image is diagnostic quality. The patient was able to move easily onto the X-ray table. She laid flat on her back, arms at her sides for the AP. According to Bodentrager, the knees could have been bent to reduce the lordotic curve of the L spine and to open the vertebral joint spaces further. The CR was centered to the iliac crest. Seen here, the crest's right here, and it's in the center of the image, so we centered at the crest. Collimated on all 4 sides to include T12. Oh, am I wrong? Wait, I gotta look that up. T11? Wait, T12. I can't remember. Sorry. And the sacrum down here, and the SI joints right here. Okay. The patient was changed. She was in a gown. Her shorts had a bunch of sparkly stuff on it, so we just had her change into a gown, remove bra, everything jewelry. The 5 lumbar vertebrae bodies are shown. Joint spaces are seen. These are 1, 2, 3, 4, 5. And the transverse processes are seen. The SI joints are seen. The sacrum is hard to see through their gas pattern. Shield was placed over her chest to protect the breasts. All right, moving on to the lateral. This is the lateral. Technique was 96 at 20, 96 kVp at 20 mass. There's clear bony detail, no motion demonstrated by sharp trabecular markings. The exposure is diagnostic quality. Patient was placed on the left side with the L spine centered to the long axis of the IR. The knees were slightly bent, and the CR was centered to the iliac crests right here. It's centered. Where am I? Collimation was left open, which included the sacrum and the coccyx down here. I believe the collimation could have been reduced from the top to the bottom just to clean up the image a little bit. We didn't need all of this. Maybe just a little bit less of the top. 1, 2, 3, 4, 5. Maybe just less of the bottom. The patient seems to not be completely straight. I think there's a slight curve going on. It could have been more like that. It's either, I could have either brought her shoulders back a little bit, or I could have maybe turned the collimator box to match the length of her body to the length of my image receptor. The vertebral bodies are shown: intervertebral joint space, the spinous processes, and the sacrum coccyx. Alright, this is the L5 S1 joint space, because it wasn't completely clear on the lateral image. There is bony T-tail. I think this image is slightly grainy. The technique was 96 kVp at 30 mass. I think that the mass could have been increased. I think it would have taken care of, okay, let's see, you'll see it when well, no, the images aren't going to be as good as this, but it's kind of grainy. So I think the mass probably needed to come up to take care of the model grainy. So the CR was angled, cotted towards the feet about 5 degrees, and I centered the CR 1.5 inches below the iliac crest, and then collimated to just the area of interest, which is L5, the joint space. I think her knees still in this, as in the lateral, I believe that her knees could have been flexed more. I think she is maybe a little too straightened out. I think maybe it would have opened this joint space more. I think if her knees were like bent more. The image demonstrates the L5 vertebral body right here and the L5 S1 joint space right there. The patient is not over rotated. That's evident by the greater sciatic notches and the iliac crest. They're superimposed, and the sciatic notches right here. And that is all. Thank you.